Millions of people are on GLP medications right now, and most of them were handed a prescription and sent home with almost no explanation. No one told them what the medication actually does, what it does not do, what their body would need while taking these medications. So, in the next few minutes, I'm going to tell you what I usually tell my own patients, the stuff that usually gets skipped during visits. Real quick, I'm Dr. Brian. I work in obesity medicine. It's a fancy way of saying I work in weight management. This is what I do every day. And I'm not here to sell you on these medications or scare you away from them. I'm here to make sure you understand them because an informed patient can make better decisions. First thing, GLP-1 is not some lab invention. It is a hormone your own gut already makes. Every time you eat, your body releases it. It tells your brain, we are full. It slows your stomach down. It helps your blood sugars. These medications take that natural signal and turns up the volume. That is why so many people describe the same thing in the first few weeks. The food noise gets quiet. That constant background chatter about food, when to eat, what to eat, whether you should, for the first time in years, it goes quiet. That is not magic. That is your own biology finally getting some support. And some people listening may say, I don't have that on the earlier doses. It's because you're not focusing on your foundation. That is the most important thing, and I'll go into that a little bit more later. It is important to know your medication. Wegovy and Ozempic are semaglutide. They work on the GLP-1 pathway. Zepbound and Mounjaro, which is the same drug, it's just branded for diabetes, are tirzepatide. They work on GLP-1 plus a second hormone called GIP. Different tools, neither is automatically better. Your body and your doctor can decide the fit. Now, here are 5 things that almost nobody explains at the pharmacy counter. Or maybe they do. 1, less hunger does not mean less need. Your appetite drops, sometimes a lot, but your muscle does not know you are not hungry. It still needs protein every single day. Under eating on these medications is also the number one mistake I see. It causes the fatigue, the hair shedding, the plateaus due to cortisol increase. 2, most side effects have a story. Nausea usually can mean that the meal was too big, too greasy, or eaten too fast, or the fluids are off. Constipation means your slower gut needs more fluids and more fiber, not less food. Fatigue usually means underfueled and underhydrated. These are just signals that your body is always telling you, not mysteries. 3, the scale will lie to you. Water, sodium, inflammation, muscle. It all moves that number day to day. Watch how your clothes are fitting. Watch your energy levels. Watch how quiet the food noise is. That is a real progress report. 4, hunger coming back is not a failure. Before you assume you need a higher dose, check what you're missing. Check your protein, your fluids, your sleep, your stress. 9 times out of 10, the answer is in your routine, not the dose. 5, the medication does not build a life. It quiets the noise so you can finally listen. Protein, fluids, sleep, strength, rhythm. That foundation is yours to build, and it is what decides your long term results. Who wants to lose weight and then regain it back later? Focus on the routine. Now, let's talk about who these medications are for, because here are the real criteria. It can be for anybody. But in general, doctors look at your BMI, your body mass index, a BMI of 30 or higher, or 27 and up with a weight related condition like high blood pressure or sleep apnea, if your insurance covers it. And if you're on Medicare, listen closely because this just changed. As of July 1st, there is a new program called the Medicare GLP-1 Bridge program. For the first time, eligible people on Medicare can get certain GLP medications for $50 a month. The basic requirements: you need Medicare with drug coverage Part D. A BMI of 35 or higher will automatically qualify, or 30 and up with a qualifying condition like uncontrolled blood pressure, certain types of heart failure, prediabetes, chronic kidney disease stage 3. Your doctor can submit their approval. And per the Medicare guidelines, it says they're going to run it till end of December of 2027. So if you think you may qualify, ask your doctor about it and do not say Dr. Brian recommended it. Others, they'll blame me. The Medicare GLP-1 Bridge programs like this can only help the people who know they exist. But here's the truth about all this. These medications are a tool, a real one, for the right person, and it is a powerful one. But a tool in the hands of somebody who has never taught how their body works only goes so far. That is the actual problem. Nobody teaches you your own body. Not the hunger hormones, not the signals, not why cravings hit when they hit. So here's what I'm going to do. In my podcast, Obesity, The War Within, which is on Spotify, YouTube, Apple Podcasts, I'm going to go more in depth into GLP medications from top to bottom. The common questions, the side effects, the mistakes, the fixes. How to actually understand your body and the real secrets to weight loss. The ones that have nothing to do with punishing yourself, crazy restrictions, all that constant noise around you, everything your appointment never had time for. So, subscribe now. Turn on that notification bell if you know where it is, because I don't want you to miss it. Make sure you send this to somebody on these medications who are handed a prescription and nothing else. They deserve to understand what is happening in their body. One last message. The body is not the enemy. The body is responding to your signals. So please listen. Pay attention to what your body needs. And on the podcast, I will teach you its language. Remember, this is education only, not personal medical advice. Talk with your own clinician if there are listeners. Have a blessed day.